Hello, this is Dr. Jason Munsell. It is about 12:45, July 20th. This is day 8 of our online class, and it's the end of the second week, so this is sort of like a midterm time, though remember, no exams. I'll say a little bit more about the second big assignment, the prescription stuff, toward the end of this hopefully brief lecture. And I still need to look at the latest tweets and threads, but I have finished grading all of the dialogues that were turned in. A few of you did not send me stuff. So hopefully this will be somewhat helpful for the assignment that's due again by the end of the day on Sunday, or 5 o'clock on Sunday. Maybe not, I don't know. Well, the deadline is the deadline, but I don't know if this will be helpful or not. But hopefully it will be, because I know several folks have emailed me a little bit confused about this second assignment. So let's just get through some of chapter 5. Yeah, I just look at this. I don't know if y'all are even watching these things. I look at the view counts, and not too many people are actually watching this stuff, so it's really just for me, I guess. Autumn, I know you're watching. Thank you for that. But, okay. This lecture is sort of like hemorrhoids. It's going to be a pain in the butt. But so, okay. Chapter 5, Caregiver's Perspective. Lots of careers out there. That's really cool. So the first big section is career preparation, thus the preparation H, which I just thought was funny. Okay, so yeah, you can't see this very well, can you? Some of the highlights here, and I'm just hitting some of the high points. I'll let you read. But you know, when folks go through the process of preparing to be caregivers, whether it's nursing school or medical school, they do have much, you know, obviously it's a science-based curriculum. And so in a sense, they are learning that way of looking at the world, sort of a scientific voice of medicine, biomedical, and all that type of stuff. So in that way, they are trained, in a sense, to see the world a particular way. That does not always help caregivers you know, see things in a way that is advocated with the more of the collaborative model. But there is communication training, and it's getting a lot more important within medical preparation or caregiver preparation. There are a lot of stuff where the Accreditation Council on Graduate Medical Education, the ACGME, have said effective communication skills are at the heart of quality patient care. Yes, and so they stress interpersonal communication, teamwork, leadership, things that they learn or should learn in school. And communication training is most effective under 3 conditions. They say one is involvement by a diverse array of caregivers, such as physical therapists, nurses, doctors, and health educators. So everybody gets communication training. Another is the use of experimental activities like role playing, which is sort of cool. Like the role I'm playing right now is teacher. You're supposed to be a student. But you know, trying to understand things from another point of view is very important. Did I skip one? Oh yeah, I skipped. I went straight to the preparation H, and I'll come back to this. Another one is a third essential element is integration of theory and goal-based performance. So it's not just theory stuff that you understand, practice, deep understanding of to be an effective communicator, educated communicator. You not only want to be able to communicate effectively, but know why that actually is effective. So theory stuff. One of the things that I think is important, and I skipped this and went straight to preparation H. I think we need, as patients, and I know some of you work in the healthcare system or industry, but since all of you are undergraduate students, I'm assuming none of you are medical doctors. But oftentimes I don't think we have the empathy that we should for particularly medical doctors, and what their life is like, and then the time, just their day and how they see the world. And sometimes if they, maybe they can have bad days too. They cannot feel, well. So we just need to think about that. And also, I think we need to appreciate the broad spectrum of caregivers. Sometimes when I go get my meds at CVS, just listening to some of the other folks and they're, getting their drugs, and it's just, oh my God, what patience these folks, the workers, not patient as in patient and provider, but patience these folks have for some of the people getting drugs and all the various questions, poor, yeah. So yeah, I'm saying I'm going to focus, but so as patients, I think we need to have patience for our caregivers and try to have empathy. Okay, so yeah. Some of the stuff, so I talked about the Comm training and socialization again. Voice of medicine. Once again, I mean, doctors and caregivers learn, how to behave, how to see the world, how to communicate. So we need to understand that. There's lots of things going on with a hidden curriculum that I'll let you look at. But oftentimes, particularly in medical school, they're isolated. There is a very sort of structured hierarchy within the process of caregiver training. And oftentimes they resent or learn to resent patients depending on the situation. So we need to appreciate and understand all of the preparation that goes on. But I think the big point is that people are understanding in the preparation that caregivers need to learn effective communication. All right, so the system level, the next little section talks about, that box 5.2 medical school reform is really pretty interesting. Look at what Harvard is doing. System level influences. So the first bit is about, how are caregivers prepared? What are some of the facets of their preparation? And then the next little section is just the system, how our healthcare system, and the culture impacts everything. Organizational cultures. We have different organizations. The hospital is an organization. Insurance company is an organization, and organizational culture is just generally this idea that there's certain norms within that given organization, and people start sort of seeing the world in the same way. They say basic beliefs and assumptions about organizations, members, blah, blah, blah. So in light of that, one of the big things, this is one of the things that I wanted you to, or this is the fourth form, dealing with issues of time. Because of the system, oftentimes caregivers have to limit the amount of time that they see patients. And one of the things that's important that the book doesn't really talk about is time itself is cultured, the way we look at time. And in the United States, particularly in Western cultures, we're very sort of, appointment this time, blah, 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 blah. We see time is money. We have that sort of way of looking at the world, which is not the only way to think about time as an abstract. I mean, is there really time at all? Maybe it's a fabric of our imagination. I don't know. What time is it? Time for something. I don't know. But in any case, so here's some of the stuff that I think is really interesting. So researcher and psychologist is on page 105, and this is where I'm getting into some cool stuff that I think you could use for the caregiver's bit of the prescription assignment. And by the way, I'm not asking you to prescribe drugs or anything like that. You know, the idea of prescribing things is not just about medicine. I can prescribe, you know, that you read your book, blah, 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 blah. So what all you're doing here is prescribing general effective communication skills or practices. But this is what Jeffrey Rudolph says: tips for bonding with patients when time is limited. Start strong. Go into that room, start strong. Shake hands. Look the patient in the eye. Inspire trust from the beginning. Do not interrupt and do not multitask. Give the patient your full attention. Do not empower patients. Provide information, web links, follow-up phone calls, and other means of encouraging the patient's active involvement during and after the encounter. Do not end the visit before you ask if the patient has other questions or concerns. You are not actually saving time if the patient leaves without knowing what to do next. And even if you make note to address some of the concerns on the next visit, it is ultimately more efficient to encourage full disclosure than to remain in the dark about what a patient wants and needs. Some very simple practices, but can be very, very important. And again, these are things that you could list for the caregiver's prescription, page 2 of this assignment that's due on Sunday. So, tips for bonding. Some other stuff that I have to say that is neat when they move into all the stuff about psychological influences on caregivers, and I'll let you read a lot of that stuff, but there's some really interesting things that I thought, again, could be very, very practical for this upcoming assignment or the assignment due, and that is